Is a very small physician group, about 5 clinicians, required to report for 2022?
Unfortunately, Lillian, the answer is yes. After 3 years of automatic exceptions for COVID, there's no automatic exception for 2022. And we expect the public health emergency to officially end on May 11th. So, again, no automatic exception for 2023 either. Now, there is an extended deadline specifically for COVID related hardships that ends or ended Friday, March the 3rd, 2023 at 8 p.m. Eastern Time. It's specific to COVID. It's called the Extreme and Uncontrollable Circumstances EUC exception. Application for exceptions are available every year. The program is not specific to COVID, but the extension for the application this year is specific to COVID. Application can be made on the qpp.cms.gov website. If you go to the website, at the very top of the homepage is a policy statement about the EUC and links to get deeper explanations and to get to the application. It's not a big task to make an application, and I expect you need to have a credible explanation of why COVID was particularly hard on your practice in 2022. But I'm expecting CMS to remain fairly lenient on granting exceptions, but watch for their reply. You aren't off the hook for a submission until CMS tells you you're off the hook. Now, it is becoming progressively more difficult to earn an incentive in the MIPS program, and even to meet the quality standard in APMs. And if you do earn an incentive, the positive adjustments remain fairly small. Penalties for no submission in the absence of an EUC exception are now at 9% of Medicare payments. So there's a substantial amount you can lose by not making a submission. It is relatively easy as a small practice to make a submission that will, at the very least, prevent maximum penalties, if not take you into the incentive range. If you make a submission, you'll be graded on cost if you have cost measures applicable to you, and you'll also earn a small practice bonus of 6 points. You're liable for the practice improvement category score unless you are granted an EUC for that. As a small practice, if you don't make a promoting interoperability submission, your promoting interoperability points are redistributed, bringing quality category up to 40% of your total score, improvement activities up to 30% of your total score, and maintaining cost category at 30% of your total score. You get 6 quality points for being a small practice if you make a submission, and you get a minimum of 3 points for each submitted measure, independent of your performance level, and even if you do not meet case minimums or data completeness criteria. So again, it can be easy to make a qualifying submission and reduce your total negative adjustment. Though again, with a minimal submission effort, you won't be likely to get into the incentive range. So thanks, Lillian, for the great question.